What is Lamotrigine? Lamotrigine is an anti-seizure medication that works by blocking the voltage-gated sodium channels. Lamotrigine can be used to treat focal and generalized seizures and is also effective for bipolar disorder. Lamotrigine is used for patients with bipolar disorder who are not currently symptomatic. It appears to reduce the risk of future episodes of depression. Common side effects of lamotrigine include nausea, sleepiness, headache, vomiting, trouble with coordination, and rash. Serious side effects include excessive breakdown of red blood cells, increased risk of suicide, severe skin reaction, and allergic reactions, which can be fatal. Patients using lamotrigine often develop a benign rash. However, a potentially life-threatening rash due to Stevens-Johnson syndrome or toxic epidermal necrolysis can also occur, particularly in children. Stevens-Johnson syndrome and toxic epidermal necrolysis represent different endpoints along the same disease continuum. Stevens-Johnson syndrome manifests with skin detachment involving less than 10% of the body surface area. Toxic epidermal necrolysis has more than 30% skin involvement. Patients with Stevens-Johnson syndrome toxic epidermal necrolysis typically develop flu-like symptoms, for example, fever, malaise, myalgia, followed by extensive cutaneous and mucosal lesions. Histopathologically, lesions are characterized by epidermal necrosis and subepidermal bulla. Micrographs showing full-thickness epidermal necrosis with a basket weave like stratum corneum, and separation of the dermis and epidermis on skin biopsy. The first appearance of any rash requires discontinuation of the drug immediately because Stevens-Johnson syndrome toxic epidermal necrolysis and benign rash cannot be distinguished reliably. Other anti-seizure medications associated with Stevens-Johnson syndrome toxic epidermal necrolysis include carbamazepine, phenobarbital, and phenytoin. A 14-year-old boy is brought to the office by his mother due to seizures, which are usually characterized by a blank stare and lip smacking followed by generalized shaking. The patient occasionally bites his tongue during the episodes and feels confused afterward. The seizures have been refractory to various antiepileptic medications, and lamotrigine is prescribed. The patient should be instructed to seek medical care immediately if skin rash occurs. Gastrointestinal symptoms, for example, abdominal pain, diarrhea, are relatively common with metformin, as well as some anti-seizure medications, but are usually not life-threatening. ACE inhibitors can cause a non-productive cough secondary to elevated bradykinin and substance P levels. This adverse effect can be mitigated by switching to an angiotensin II receptor blocker. Gingival hyperplasia is a common adverse effect of phenytoin, appearing in about half of patients who have been taking the medication for 3 to 4 months. It occurs due to increased expression of platelet-derived growth factor, which causes the proliferation of gingival cells. Red-orange urinary discoloration is a harmless side effect of rifampin, a medication used for the treatment of tuberculosis. Lamotrigine can be used to treat focal and generalized seizures and works by blocking voltage-gated sodium channels. Stevens-Johnson syndrome toxic epidermal necrolysis is a rare, life-threatening adverse effect characterized by flu-like symptoms followed by widespread mucocutaneous epidermal necrosis.